This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
Okay, good morning, everybody. We'll make this one pretty quick. So we don't give a ton of PO medications in the emergency department because most of our emergent conditions require IVs and more aggressive, quicker treatment, quicker resuscitation, all that stuff. But we do sometimes give PO antibiotics. And an interesting study came out a couple weeks ago. It's published in a journal called The Physics of Fluids, and it looks at what position the patient is in and how quickly they absorb PO medication. So any ideas about what the best or worst positions might be? So they looked at patients on their right side, sitting up or laying supine, and laying on their left side. So they found kind of surprisingly significant differences. And it has to do with the shape of the stomach. So it was all done through a model, but the model seems fairly reliable. But there's several parts of the stomach, from the esophagus down through your sphincter into the body of the stomach, and then something called the antrum, which is right before you get to your pylorus. So now remember, the stomach is not really involved in digestion in terms of absorption of nutrients. It's really just involved in acid and breaking down and deconstructing what you eat, and then it passes through the pylorus into the small intestine, and that's where the majority of quote-unquote digestion happens. So the quicker you can get the food from the stomach into the small intestine, or in this case a pill, the more likely it is going to go through into your bloodstream and then go through hepatic first pass metabolism and all that. So if you put the patients on their right side, the pills, by gravity and by the way that your stomach is shaped, tend to get towards that antrum, which is right before the pylorus, sooner. So they'll actually get those pills into their circulation sooner. Then the next best is sitting up or lying supine, and for on their left side, the pill just kind of sits in the body of the stomach and doesn't move forward as quickly towards the pylorus and towards the small intestine. So the left side is the worst. The magnitude of differences was fairly significant. They felt that laying on the right side sent pills to the deepest part of the stomach 2.3 times faster than upright. And if you lay on your left, it could take, they would think the average was about 23 minutes to dissolve the pill and get it to the stomach on the right side, and it was over 100 minutes when it was on their left side. So this is it's a model-based study, and it's kind of just one study, but it's worth trying. If you're giving PO medications and you can potentially get therapeutic relief faster, and the patient can tolerate, just say, why don't you lay on your right side while you take this medication? It may get in their system faster. So kind of a fun study.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.